Previously, before coming to see your family services here at Briggs Family Dentistry, I had stopped going to the dentist because I'd had a problem with the previous dental experiences. And I have a really bad gag reflex, and I have sleep apnea. And so between the problem with the sleep apnea that always keeps your throat irritated and the bad gag reflex, the previous dentist I had been going to see never did anything to help me, and it was just always a struggle. So it was so much of a struggle, I quit. I stopped going for about 6 or 8 years to the dentist. And then when we found your services, I came, and from day one, everybody here has been very helpful for me. And they experimented several times with some different procedures to, assist me to be able to actually receive dental service. And after being here for a few years, my mouth is near back on track of being the way it should be, or at least the best we can consider my circumstances. But without your people willingness to work with me, I probably would not have received dental care at all again. I was just that bad.
When I was growing up, we never went to the dentist unless we had a problem, and I didn't have any cavities, so I never went to the dentist. And then as an adult, when I went the first time, it was a horrible experience, and I was terrified, avoided the dentist at all costs. And because of my hearing impairment, when you go to the dentist and they put a mask on, I couldn't understand what they were saying. And so it got to the point where obviously my mouth was a disaster, and I was forced to find a dentist. And my brother-in-law recommended your office. And when I came in, the staff was so incredible because I felt like that they understood my hearing impairment to start with, and secondly, I felt like that they were concerned about finding out what would make me comfortable. So when they told me that I could have sedation, I was all excited about it. And I came in, and that first experience was amazing. I could not believe how easy it went. And so when I came back in the second time, I said, maybe I could try it without the sedation. And honestly now, I look forward to coming to the dentist because I get to take a nap. It's so exciting. It's like my busy schedule, I'm like, just give me a break. Just let me go back in the chair and sit there. And it's because the atmosphere, made me feel comfortable. I didn't have to be worried about, was I going to be able to understand what somebody was saying? Would I be feeling a lot of pain? I didn't. And so I've been so pleased with my experience here.
My previous dental experiences were horrible, and I don't know whether it's because way back when, they didn't have the updated procedures, but when I went to a dentist as a child, it was a horrible experience, and I've been afraid ever since. So when I started having some dental problems back at the beginning of the summer, I thought, I don't want to do this, don't want to do it, don't want to do it. So finally it got to the point, and I knew I was having some periodontal issues too. And I didn't want to go to a periodontist, and so I finally came here. And actually, I think I found you through the phone book, and I said, well, okay, let me just try this. And after several phone calls and hanging up, I finally decided, well, I would just come in, and I was so scared. When I first came in, I don't remember who was sitting at the front desk, but I noticed, first of all, everybody called me by my first name. And from the whole time I've been here, they remember me. And so that makes you feel good automatically. So they knew how nervous I was, and they held my hand. And this is before I even opened my mouth, because I said, I need something to open my mouth. And so after my first experience here, and your periodontist sort of looked through my mouth and decided some things that needed to be done, I was scared to death the second time. And then after the sedation, it was like, all of a sudden I said, well, when are you going to get started? And you said, well, you're through for the day. And so that made it a good experience. And every time I've come in, I've become less afraid and less afraid.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, sedation dentistry. According to the Briggs family, they say you don't have to be afraid to go to the dentist anymore. I'm still surprised, I guess, because I have pretty good teeth, that people are that afraid of going to the dentist. So you face this all the time?
All the time.
What do you say to somebody watching this, and I guess their teeth are starting to, decay and fall apart and get weak and things like that?
I would start by saying there's never a better time than right now. Is go have it checked out. It's not going to get better on its own. So let's make a plan together. And the longer you put it off, the more work needs to be done.
What about insurance and sedation dentistry? Does it cover it?
It's pretty standard stuff. And from most of the cases that we've done, the insurance has no trouble at all paying a benefit for this sedation.
Now, some sedation is not covered. And what sedation is that?
It depends on the policy they bought.
Okay.
And that, Aetna could have 10, 20, 30 different policies. It's all that.
But it's not a lot of money, though. I mean, because you did tell me, even if insurance is not going to cover it, it's not a lot of money.
I can't think of a service that we do in dentistry. The people who avail themselves of that don't think that's the best value we've got.
Doesn't everybody know that you can be sedated one way or another? I mean, I don't think much about it.
No.
But people don't know.
I think it's a growing trend in dentistry. It's probably always been available, but just as of recently, it's growing in dentistry. People are
nationwide. What are the stats? 1 out of 20 dentists do this?
No, I don't think it's that.
1 out of 100 dentists?
I'm probably closer to that.
So it's rare. So it's not that
but
common.
See, that's if you include nitrous oxide and everything, it might be 1 out of 10 or 20.
Yeah, but we're talking about different levels of
conscious oral sedation.
Okay, right. So what are I asked you earlier about the different levels, and I think we talked about a pill. We ended with a pill where they have no memory of the experience.
Right.
And you said something about a pill the night before.
So we will give them medication the night before, and that just helps you sleep. And it has a long-acting life to it.
That's right. There's an anxiety knowing you're going to the dentist the next day.
Correct. So you get a full night's sleep the night before, and that drug is still in your system, so it interacts with the next medication that we give you the morning of. The morning of an appointment is that first hour is just me sitting and talking with the patient and incrementally giving them medication. We have a sedation suite where we can close it off and just put on music or a movie or something. And until that person says, yeah, I feel comfortable, we just sit and talk for an hour.
Okay. Now take me through that process. Okay, so the day before, they've decided I want to get sedated. Mm-hmm. They decide on the treatment plan. The next day they come in, immediately they check in. They know what they're in there for. They've had the pill the night before. They're relaxed. They go into the sedation room. They have another pill. What, 15 minutes and they're ready to go?
Everybody's different. That's why we reserve that hour.
Okay, so about an hour.
Sometimes 15 minutes. Sometimes it takes the full hour to get them sedated to the point where they're
So for x-rays and everything on this second day, potentially?
No matter what the appointment is, it takes that hour to get them comfortable, and then we could spend 3 or 4 hours working on them. We could spend maybe just 30 minutes gathering records. We use different drugs for different amounts of time.
So you call that oral conscious sedation. What's the next level?
The next level is intravenous or general anesthesia.
But that's rare. Is that right?
That's totally rare.
It's not always necessary. With the level of sedation that we're using, people are perfectly comfortable.
So let's talk about the different procedures you do while they're sedated. So teeth cleaning, x-rays, what else? What haven't we talked about? Root canal, I guess?
We do combination appointments where we will have the hygienist come in for the beginning and do the teeth cleaning, and then I'll come in and restore their mouth.
Okay.
You don't always know what's going to happen before you start an appointment, but we're ready to take care of anything.
Are there any benefits to sedation?
Oh yeah.
That's what it is. It's just it's all benefits. It makes it safer for patients.
Safer how so?
A patient will start out, they'll come into that appointment and blood pressure way off the charts. We're up at 180 over 110. We start the sedation process, and a half hour into it, they're back to normal blood pressure because they were so anxious about coming in. That makes the appointment much safer.